Hello, I'm Eric Logothetis. I'm here with Uza Hamad and Abananis Radassan. And today, on our first podcast, we're going to talk about autonomy. So, Uza, what is autonomy?
So, autonomy is essentially the principle that a patient has the right to choose what happens to their body. They're able to choose their own treatment. So, a medical practitioner cannot be involved. They cannot impose a certain treatment on anyone, except in cases where the patient lacks mental capacity. So,
Right, okay.
yeah, Eric, go ahead.
No, I think
That's,
that's quite a
that's
good definition for it. I don't think I can really add on to that.
so another thing we should probably talk about is the building onto your point about autonomy is the Emergency Doctrine Act. So what it actually is the concept is that consent may be hard to obtain for patients that can't make for patients that whose lives are at risk. So yeah, is there any other points you want to make about the emergency doctrine?
So, are you saying that the emergency doctrine is where patients may be given life-saving treatment if they lack mental capacity or if it's an emergency situation?
So it's more to do with what's best for the patient. So if the patient's life is at risk, then this act allows the medical professional to make that decision for them. And this also touches on beneficence, which we might talk on later in another
Yeah,
podcast.
doesn't that quite goes against the autonomy if the doctor gets to choose rather than the patient
But this
and what
is
treatment they want?
this is in quite exceptional circumstances. This won't be happening for all cases, of course. This is only for when the patient's life is actually at risk, and where it might be better for someone else to choose whether they do or do not get treatment.
Right, okay. Yeah, so there's quite a fine line between really when it's better for the patient to choose. I see what you mean, yeah.
Yeah, it's it can be quite hard to decide, especially if the patient doesn't want treatment. As we'll look at a case study later on of a patient who doesn't want treatment, although his life's at risk.
Yeah, I think that this quite nicely links onto the Mental Capacity Act, which it basically, in essence, ensures that patients really they're sort of tested in a way for patients over the age of 16 and tested in a way so that they can be the doctors can know if they sort of can make their own decisions by themselves rather than the doctors making them for them. So if they would fail this test, they would it sort of links onto the emergency doctrine where they would choose what's better for the patient. I mean, it can be for very non-serious circumstances, like whether they what they want to wear or whatever. But it can be onto also things like whether someone particularly elderly would move into a care home, or just a general person would have major surgery.
Eric,
Yeah.
what sorts of people would be involved in this Mental Capacity Act? So, which people lack capacity according to this act?
Is there like a scale or something? Because there must be a point. There must be like a defined line. Is there a defined line between whether a patient's able to make their own decision or not?
So, to reiterate my question, I just wanted to ask you, Eric, can you give examples of people who may lack mental capacity?
So it would be it's a wide range of people, but they include people with dementia, learning disabilities, particularly severe ones, brain injuries, strokes, etc. Really.
So, now let's move on to the case study. So, a 26-year-old male has been involved in a high-speed collision in which he sustained blunt force trauma to his head, as his head hit the front windscreen of his car. He did not lose consciousness, he is fully responsive and has no indication of neurological damage. He does, however, have a significant head wound that is bleeding continuously. This patient has refused treatment on the grounds that he feels fine, and is refusing to have sutures to close his head wound. He would like to leave the department,
So
and he's repeating the fact that he's fine.
So I do.
So,
think,
what are your opinions on this? Oh, sorry.
It's fine. I do think that this does link to the emergency doctrine. The patient here, he's clearly his life. Although his life may not be at risk, the injuries are quite significant. It says that it. You mentioned that his wound was bleeding.
Yeah.
So that does indicate. That's a clear indication that his life may be at risk.
It says that it's a significant head wound, so while your
Yeah,
argument may be correct, would it be considered an emergency? Because
I
that's
think
the
it-
only...
I think it would really. The doctor would have the final decision here because it is a head injury, and I mean the Mental Capacity Act was designed to protect people in these circumstances who really aren't capable of making their own decisions. And if the doctor feels like that patient's life is at risk, then he should certainly ensure that
However,
that life is saved.
In terms of your Mental Capacity Act, it says that he's fully responsive and indicates no neurological damage. So, does he really lack mental capacity? If he refuses treatment, who has the right to stop him?
I see what you mean. Yeah. So maybe he wouldn't fit in that box of lacking mental capacity, but is still really at risk.
Yeah.
I mean, it may not be a severe life-threatening one, but you know, it will have some sort of effect.
Yeah, this case does lie on that fine line between whether his life is actually at risk or whether he's okay. Also, you mentioned that he said he feels fine.
Yeah.
Most people after extreme injuries, they tend to say this as well because of adrenaline. So this could be the case that he will be feeling extreme pain afterwards. But right now he might not feel anything because since it's soon after the injury, due to adrenaline, he might not actually feel anything. So this injury might actually be a lot worse than he says it is at the current time of the accident. That could be the case.
There's no real way to tell things like that.
Yeah.
So it's really would it be better for the patient to stay in for a couple more hours, maybe a day or so, spend overnight?
Yeah.
You know, or
I
should he
agree
go
with
home?
both of you there as well, because it says he did not lose consciousness as well. So if he didn't lose consciousness, he probably still had adrenaline from the crash.
Yeah.
Yeah.
And so the outcome of the thing was that the best interests, even though the best interests of the patient would be undergoing a CT scan, since he had full mental capacity and had no neurological damage, the medical professionals let him leave the department without getting any stitches. And if they prevented him from leaving, that'd be illegal, because it's known as unlawful detainment. Because he didn't lack any capacity, fully autonomous,
Yeah.
and was able to
Right.
make the decision himself to leave.
This does also bring into question whether what's lawfully right is what's morally correct. So even though that patient, by law, he could walk out of the department completely fine, without having sutures or stitches to close his wounds,
Yeah.
I don't think it would be morally correct to just let him go. At least he should have, as Eric mentioned, he should have been kept for at least a few hours, maybe even a day or a night, just to see how his injuries develop. Because oftentimes, right after the injury hasn't reached its peak in terms of damage due to secondary damage. So maybe after a day or so, the injury would have worsened, where it could be considered life-threatening. So I do think.
I think when thinking about ethics, there's a really fine line between what's legal and what's ethical.
Yeah.
So, like euthanasia, there's much less ethical and much less legal. I think
Yeah.
Eric, didn't you want to say? Oh, sorry, Abanayan.
Yeah. I'll talk.
You want to say some stuff about euthanasia?
So, euthanasia. Euthanasia actually means a gentle and easy death. That's what the term means, and the term's used to describe ending a person's life deliberately, due to compassionate reasons, because they're suffering because of a disease or an injury that can't be cured, or an injury that can't be healed. In the UK right now, it's actually illegal to carry out euthanasia. It's punishable by imprisonment, life imprisonment, as well as assisted suicide. That's also illegal, and you could face jail time up to 14 years if you're involved with this. there's also quite a few types of euthanasia as well. So there's active euthanasia, where something's actually done like a drug's injected, for example, where a drug's injected into a patient that's suffering to intentionally bring about their death, as well as passive euthanasia. So another one is passive euthanasia, which is, it's like the active euthanasia but without any form of treatment. So it's where treatment that would usually increase a person's life expectancy, such as a life support machine or a feeding tube, these can be removed and let the person die off slowly. This is actually legally allowed in the UK, and technically it's not actually euthanasia because you're not involving yourself. It's not really considered euthanasia legally. And then another one is... yeah.
Wait, would it be not considered euthanasia because the person's already about to die? So even if they still die, no matter what happens.
It's less that they're about to die. It's more to do with the it's more to do with how it's less of an active process. So there's less being done to end this person's life. It's more of a passive method.
Oh, I
So
understand.
there's no injections, it's more passive. Another one's voluntary euthanasia, where the person can actually ask for their own life to be ended. Of course, there is a sense where the doctors kind of input into this as well. Of course, you can't just go into any sort of hospital and ask for euthanasia. That wouldn't be morally just or legally right. Another one is non-voluntary euthanasia. This is a weird one. So a person can't make a decision about euthanasia. So if a person can't make a decision about their euthanasia and they're suffering or they're in a life-threatening condition, a doctor or a family member can decide, so this links on to the previous type, whether this would be in the person's best interests for their life to be ended. So like, for example, if the person's in a coma, for example, and they're suffering, and it's very unlikely that they're going to come out of that coma, the doctor or the person's family can make that decision to end their life. Of course, this is a little controversial though. Involuntary euthanasia. This is even weirder. So a person wants to live, but someone else, so a doctor or a family member, decides it would be the person's best interest if their life was ended.
I think that's quite a strange one, I'd just like to say.
That is quite a strange one. I think this might... Yeah, I'm not sure about the legal implications.
Yeah, I don't think it's legal in any country now.
Yeah, it does not.
Nazi Germany was the last place.
It does not sound very legal. But so
Can you give an example?
So for example, let's say if someone's had an accident that's very likely has a very high chance of leading to an imminent and painful death, so a car crash or something, a doctor or a family member can make that decision to euthanize them, even if the person wants to live. Actually, this actually makes more sense now. So if the person is going to die anyway, or has a very, very, very slim chance of survival, but they want to live, and they're suffering, the doctor or their family member can make that decision. So I guess, in a sense, it is sort of morally correct. If they're going to die anyway, and they're suffering, even if they don't want to die, it might be better for them if their life was cut short too.
Doctors are, meant to follow that fourth pillar, being non-maleficence, really.
Yeah.
So I don't think it seems close to murder, really, then, to help that patient if they want to live.
Yeah. But the thing is, non-maleficence always comes into play if the patient's suffering. Would it really be the morally right thing to do to keep them alive and suffering, giving them false hope that they'll survive if they have such a slim chance of survival? And another one is, the final one, assisted suicide, which is deliberately assisting or encouraging another person to end their own life. This one is, I don't know about this one. This is a bit of a weird one. So, alternatives. There are alternatives to euthanasia, and there's there's two main ones really. So one of the main ones is hospice. Uza, do you know what a hospice is, or do you have any idea of how this might?
I'm pretty sure this is where the specialist medical staff look after terminally ill patients. So palliative drugs are used to help ensure that the person doesn't suffer any more pain than like what is necessary.
Yeah,
So
yeah, that's right. And
palliative means healthcare focusing on relieving and preventing the suffering of patients rather than trying to cure them.
yeah, good. So that is what it is. But also another aspect of hospices are that they've got staff in there that can talk about patients about death and dying, and any fears they may have. So this is quite useful. This is quite it's quite helpful for people who are at that stage where their life is about to end, and these staff members, they'll be able to provide support not only to the patient but also to the family members, which is quite an important aspect, and care for their mental health. Eric, do you know what the other one is?
Yeah, the other one is refusing treatments. In the UK, all adults, 18 and above, have the right to refuse treatment as long as they've passed that. They have capacity, they've been deemed to have capacity by professionals. If they are informed about the situation they're in, they can decide not to get treatment, despite if that's life threatening or not.
Yeah, that is.
But,
Yeah, that is correct. And
that could be. Yeah.
But this
Go
does put into question again what's morally right versus what's lawfully right. Even though by law all adults have the right to refuse treatment, it does kind of bring into question the other law we were talking about, the emergency doctrine. Because if someone's life is at risk, a doctor might decide that it is better if the patient has a good chance of surviving after the treatment, then it might be better for the doctor to apply treatment to the patient, even if they don't want to. But for all of the treatments,
if they've got capacity, that has to be respected.
Yeah.
Can't force these things on people.
Yeah, that's right.
I think that leads quite nicely onto euthanasia. As Aberdeen said earlier, it's illegal in the UK, but in countries where euthanasia or assisted suicide is legal, somewhere between 0.3 and 4.6% of those deaths are caused because, 70% of those ones are caused because of cancer developing to a point where the patients feel it's unnecessary to continue without causing more harm. So, what do you guys think? Should euthanasia be used for terminal cancer patients in the NHS?
So I don't know if we should be using such a dreadful term. So because each patient is unique, and each case is unique. So some patients might want to live, and some patients might want to die. So I think it depends on the patient. But to know what we need to do, so to know if euthanasia is viable, then we have to decide what sort of euthanasia is it. So is it active, passive, voluntary, non-voluntary, involuntary, or assisted suicide?
Yeah.
And since every case is different, I think it depends on the case and the patient.
Especially here where Eric mentioned cancer patients. So so if there was a cancer patient and they decided that their chance of survival wasn't that high, it was very slim, and they decided to be euthanized, and if there was a case that in the next week or the next month a treatment for that cancer was invented or was created, would it be better for the patient for them to suffer a little bit longer, just so that they have a chance that a treatment for this illness can be invented, because they could have survived if they just pushed on a little longer, but then again, that is the patient's choice.
That brings us back really to autonomy of that patient being able to decide what happens to their body, whether they should live or die. But yeah,
I think for euthanasia, especially in cancer, it costs a lot to keep people alive. All those cancer treatments, palliative drugs used, it's expensive to keep them alive. And euthanasia, allowing euthanasia to occur, would just help free up some space in the NHS so they could treat people who will live longer, and they could increase the quality of life in the UK.
Yeah, there is an economical value to this, but there's also a religious aspect to this as well. So there are some religious arguments that each human has their own right, and their right is absolute. So if they want to live, they should be left to live. If they want to die, they should be left to die. But then again, this is quite controversial, because then religion gets thrown into the mix along with morals and law. But it's a bit of a weird one.
Pretty sure there's loads of religion believe that life is sacred, and I think no matter how painful it is, you still hang on to life.
Yeah. Religions do put,
which is a massive cause against euthanasia.
Yeah, it puts a lot more value onto life, which is good in a sense. But
Actually, 82% of religious and non-religious people support euthanasia law for terminally ill patients.
that's quite surprising. Was this religious people?
Of religious, 82% of religious and non-religious people support euthanasia. So it says 46% non-religious and 36% religious.
That's quite a lot. So 36%.
Yeah.
Yeah.
Yeah, that is quite a surprisingly high percentage of people, religious people. I would have expected for fewer religious people to have this view.
So I think 36% really comes from, those, would you want to see your family or friends go through that suffering for a long time, having that empathy to, could you stand watching that happening?
Another important thing is that 10% of suicides in England actually involved chronically or terminally ill people, which means that maybe euthanasia should be unbanned, because still, 10% is quite a lot when you think about how many people are in the UK.
Yeah.
And you think about how many people have cancer in the UK, or how many people are even terminally ill, not even just cancer.
But I think this brings into question more of the mental health of these terminally ill people, because although this statistic is quite significant, it doesn't actually mention the condition of the terminally ill people. Could there have been a treatment? Could there have been a way to improve their way of life? Or what was the doctor's opinion on this? Because at the end of the day, a doctor's job is to make the right decision if the patient cannot. So I think these suicides do bring the mental health aspect into question.
Yeah, Mental Capacity Act. Really,
Yeah.
If they're deemed to not have capacity, could they really? They don't really know what would happen.
Yeah.
Nobody really knows. They could even unexpectedly recover over time.
Yeah.
And that is that chance maybe even worth, as you said earlier on, staying on a bit longer for.
And building onto the Mental Capacity Act, would someone, it brings into question whether someone who was mentally ill, would that bring the Mental Capacity Act into play? If someone was mentally ill, would that definitely affect how they'd make their decisions, and whether those decisions they might regret later on? So that's quite a tough one to evaluate, whether that does come under the Mental Health Act or Mental
Capacity.
Mental Capacity Act.
Mental Capacity Act, yeah. I guess it also supposes if it needs to come under the Mental Capacity Act, the patient has to be over 16.
Yeah.
Yeah.
But
So is it under that age that the parents would choose of that minor?
Yeah, I think that is quite an appropriate age, because after the age of 16, I think most people have developed a good mental compass, a good moral compass, I should say. So I think they'd be able to make a slightly better decision. Yeah, I think that nicely wraps up this first episode then.
Yeah.
Yeah.
So thank you for attending.
Yeah.
Next month we'll be doing beneficence.
Yeah.
And talking about some more case studies. But yeah, thank you.
Stay tuned for that.
Thank you for watching.
Thank you for watching.